Hi, my name is Dr. Ross Hauser, coming to you from Caring Medical, Florida, in Fort Myers, actually. One of my more memorable cases over the course of 30 years doing prolotherapy and stem cell therapy was a patient who came in who had a 70% tear of their patellar tendon. So you see this huge amount of black here in the patellar tendon. This was an ultrasound scan that we did. And when the person went to their orthopedic surgeon, they said it was spaghetti and that she needed, arthroscopic, reconstruction of her patellar tendon. This particular person is very, very active, does triathlons, does golf, does running. And they're very, very holistic and conservative. So they wanted me to treat them. So over the course of like about 6 to 8 months, it did take a long, long time. The person received multiple PRP and ultimately stem cell treatments into the patellar tendon, and you can see that the black turns to light gray, then turns to good patellar tendon tissue. So the tear definitely filled in. I can absolutely tell you that the person's back to playing golf, back to running, back to doing everything that they love. So even really, really severe tears, and this was a 70% tear, responded great to prolotherapy with PRP, with stem cell, and the treatment can be objectively verified and confirmed with ultrasound analysis, which we just do in the office. So just a kind of a really dramatic case, but it just shows you the regenerative power of prolotherapy, even with a 70% patellar tendon tear.